A nurse is caring for four patients. Which patient should the nurse see first? A. A client with chronic back pain requesting PRN acetaminophen. B. A client newly diagnosed with diabetes needing discharge teachings. C. A client with pneumonia who is short of breath and has an oxygen saturation of 88%. D. A client scheduled for surgery in 4 hours asking about the procedure.
C.
Which client should the nurse assess first after receiving the morning report? A. A client with asthma reporting mild wheezing. B. A client who received morphine 20 minutes ago for pain. C. A client post-appendectomy with a BP of 88 over 60 millimeters mercury. D. A client with pressure ulcer requesting a dressing change.
C.
The nurse receives reports on four patients. Who should be assessed first? A. A post-op hip replacement patient needing assistance to the bathroom. B. A diabetic patient with finger stick glucose of 56 milligram per dl. C. A patient waiting for discharge instructions. D. A client with nausea requesting anti-emetic medication.
B.
Which task should the nurse prioritize during a mass casualty incident? A. Assisting with CPR on a patient in cardiac arrest. B. Administering oxygen to a patient with labored breathing. C. Comforting the family of a deceased patient. D. Documenting patient triage levels.
B.
A nurse in the emergency department is triaging patients. Who should be seen first? A. A client with suspected wrist fracture. B. A client with chest pain and diaphoresis. C. A client with sprained ankle. D. A client with headache requesting acetaminophen.
B.